Troy, thank you. Here in Michigan and across the country, a nursing shortage continues to get even worse. In fact, a recent study by the University of Michigan shows almost half of the workforce is ready to quit from overtime hours and tending to too many patients at once. The question now is what can be done to try to help the industry. This morning, we're joined by Carol Johnson from the Health Resources and Services Administration. Carol, thank you so much for joining us this morning.
Good morning, Sandra. Thanks for having me.
In your opinion, what do you think is the most pressing issue right now nurses are facing?
Thank you so much for the chance to be here during this National Nurses Week. I think one of the things that's really important that we do is recognize and thank the nurses who have done such incredible work, both getting us to this point on the with respect to the other side of COVID, really working hard um, every day in hospitals and schools and long-term care facilities and in behavioral health and maternal health. Nurses are the backbone of the healthcare system and the largest health profession. And they are who's doing the work to keep us all healthy and safe. I think it's really important that going forward, we recognize that not only in the salary and compensation that nurses receive, but also in the well-being and other supports that are really focused on the work environment and make sure that nursing continues to be a place where people want to make a career.
And I know, I feel like we started talking a lot about this during the pandemic, especially talking about the numbers, right, as far as the nurses to patient ratio. What can you do to even begin to combat that if we're talking about not enough people in the workforce?
Yeah, there's some good news and then there's work to be done. The good news is we conduct the largest federal survey of nurses every couple of years, and we just have the first results post the pandemic showing again that there was a significant net increase in nurses who joined the field. But at the same time, the population's aging, so the need for nursing continues to grow. So we need to keep recruiting new people into the field. And one of the ways that we do that at the Health Resources and Services Administration are things like scholarships and loan repayment to make it possible for people who otherwise couldn't have afforded to go to nursing school to go to nursing school. And what part of why we use those loan repayments is to incentivize nurses to practice in places where the shortages are the highest. And so we're really focused on wrapping around young people who want to be nurses, people who want to make career transitions to become nurses, and helping them with scholarships, stipends, all the things that make it possible to join this profession.
And you mentioned, some of the biggest challenges. What would you say is there's got to be a silver lining in all of this, right? A lesson to be learned. What do you think that takeaway is?
Yeah, well, one of the things that is really exciting about our newest survey results is that the nursing workforce is becoming more diverse, which is really important to have a workforce that looks like the communities that they serve, that really reflects the nation, because that's trusted messengers. People respond well to a workforce that reflects their community. The nursing workforce is also getting a little bit younger, which again offers opportunity for longevity in the field as we continue to recruit more nurses. But it's also important that people who've been in the field for a really long time, that we incentivize them to stay and maybe even become nurse faculty going forward, because having nurse faculty is the key to opening up more seats in nursing schools.
Certainly so much to explore with this topic, and it's definitely a fascinating conversation. Carol, we appreciate you being here with us this morning and sharing your insight.